If you're watching this video, it's probably because you have lateral elbow pain. Lateral elbow pain. I will offer a self-diagnosis, suggest a treatment, and provide exercises to help resolve the issue. Today, let's discuss epicondylitis, a common pain that many patients ask for our advice on. This issue frequently presents in the clinic, and we often receive numerous inquiries regarding it. The first thing we have to know is if we really have an epicondylitis, then we are going to give you 3 diagnostic tests that can guide you a little bit on if you have epicondylitis pain. The initial act is as effortless as extending a hand for a greeting. I will perform it upon myself so that you are able to witness. But if when I shake my hand, I have pain here, it already gives us clues that maybe we have an epicondylitis. Second test we are going to do is going to be a dorsal flexion of the wrist against resistance. I resist a little bit with the other hand. And if when going up, pain appears all over this area, the same thing, it is also probable that we have an epicondylitis. The third test is called chair test. I have a case here to do it, so as not to do it with a chair, which is very cumbersome. And we're going to be with the elbow stretched out, lifting a weight. If I lift a weight with my elbow outstretched, I lift a weight the same. If when doing it, pain appears in the whole lateral of the elbow, it is probable that your pain comes from the epicondyle. So if in any of these 3 tests, or in all 3, pain appears when you do it, or directly you cannot because you have inability, that as you take the briefcase or as you do the gesture, this bothers you, it is very probable that you have an epicondylitis. Nevertheless, it is always going to be advisable to establish the diagnosis through imaging. An ultrasound or an MRI can be used as confirmatory tests. And what hurts in an epicondylitis? As I have already told you, what will hurt in epicondylitis is the outer part of the elbow. The epicondyle is this small bone that sticks out here. So all the pain that is by this zone, and that generally is in the habit of extending towards the forearm and sometimes up to the hand, is what we could include as an epicondylitis. Let's go to the second phase of the video. Let's go with the self-massage, with the treatment of the area. As we have an epicondylitis, usually, apart from the inflammation in the tendon of the epicondyle, we are going to have an associated overload in all the musculature of the forearm. The muscles come from the tendons of the hand and they insert themselves into the epicondyle, which I've already told you is the little ossicle that's here. We're going to use a spoon to help us do the massage so that it's a little bit more comfortable and you don't hurt your fingers. We utilize an exceptional cream, particularly Fisiocream, that demonstrates remarkable efficacy for these massage therapies. Very little cream we are going to apply, and we are going to spread it a little bit on the forearm. Once we have it more or less distributed, we are going to take our spoon and we are going to make passes. I previously mentioned that muscles extend from the fingers to the epicondyle. Shall we proceed and begin doing repetitions now? Smoothly, right? Upwards, right? Surely in some of the areas, especially in the middle part of the forearm, you are going to notice a point where the pain is a little bit more acute. If that happens to you, as for example to me here, I have a little more overload and it bothers me, you can take the part of the spoon that has this curve and keep the pressure a little bit, about 60-90 seconds, until the pain fades away and vanishes completely. Afterwards, we might have the chance, between 3 and 5 minutes with our spoon, going upwards towards the epicondyle. Okay? And then we're going to work on a couple of little minutes of scratching. A scratch. How are we going to do it? With the edge of the spoon, right? We take it here so that we are comfortable, and we're going to scrape the whole tendon area, okay? So this whole area, we're going to do a little scratching. It's uncomfortable, but it doesn't have to be very painful, okay? If it hurts a lot, you're putting a lot of force on it, okay? But we're going to have this for about 2 minutes or so, doing this massage. Then I'll refresh it a little bit. In the beginning, 3-5 minutes doing slow passes towards the elbow. All right, if you ever encounter a sensitive area, maintain the pressure without hesitation. And then we take the edge of the spoon and we do our scratching in the tendon area. What is often asked about epicondylitis or tennis elbow, listen, how to cure it epicondylitis. The reality is that it's a type of injury that with a good physiotherapy treatment in which you can include massage, diathermy treatment, electrotherapy, whatever your trade considers, together with a good strengthening program, is usually enough to solve the problem. In cases of epicondylitis that are very chronic, that you take many years with the pain and that type of cases, it might be wise to consider utilizing more potent treatments such as EPI or chest wave therapy in order to enhance the effectiveness. And another question that we get asked a lot is, how many days does epicondylitis last? The reality is that the inflammatory phase, the acute phase of pain a lot in the elbow, doesn't usually last more than 2 or 3 weeks. But what is the injury in healing without treatment oscillates between 6 months and a year more or less in 95% of the cases. The reality is that if we do a good physiotherapy treatment and address the injury in time, those time periods will be significantly reduced. Those time frames are going to be significantly reduced. Let's proceed to the third stage of our video and perform some exercises. As I have already explained before, epicondylitis is a condition affecting the tendon of the epicondyle. Whenever we have tendon injuries, exercise will always be an indispensable ally to resolve it. We are going to do 3 types of exercise. First, isometric. First, eccentric movements, then concentric-eccentric with slight adjustments. The initial phase, isometrics, is quite simple. Why? Because there is no motion involved. The only thing we're going to do is, the first one, we're going to make a fist. We can put a small ball or a towel in the middle if we are more comfortable, but it is not necessary. What we're just going to do is we're going to make a fist with the elbow stretched out and squeeze as hard as we can without any pain appearing in the injured zone, in the zone of the epicondyle. And we would maintain this contraction 10 seconds. We relax and we could do it again. I have already said to you, all the strong thing that you can without pain. Second isometric that we are going to do, instead of flexing the fist, we are going to do the gesture of raising the hand upwards. The hand upwards. Then, so that there is no movement, I'm going to block the movement with the other hand. And from here, likewise, I'm going to go up without movement. As hard as I can, without any pain in the elbow area, another 10 seconds. If you see that it's really hard for you, you can support yourselves. You can lean on your forearm to make it a little bit easier. Work to sustain the 10-second contraction, finding ways to alleviate discomfort. And we're going to do 3 sets of each. For the second treatment of epicondylitis, as mentioned previously, we will focus on eccentric exercises. Let's begin our work with them. We're going to need a rubber aid, and you can put a towel roll here to make it a little bit more, or a towel to make it a little bit more comfortable. So from here, we're going to pick up and we're going to step on our rubber. That as long as it has a little bit of tension. From here, we grab it. And what are we going to do? We are going to climb upwards, and above all, very important, we are going to resist the downward descent. This means that if we go up in 1 second, we have to come down in at least 3 or 4. It is possible that some of you will be disturbed on the way up, so you can help each other on the way up with the other hand, and do only the eccentric phase of descent, always slow and controlled. How many times are we going to do this exercise? Well, we are going to do 2 sets of 12 repetitions. We will always leave a minute or a minute and a half rest in between to allow the muscles to recover. And as I said, if it doesn't hurt, you can do it directly going up and just go down. But if it bothers to make the ascent, you help yourselves a little bit with the other hand. Yeah, remain steadfast and resist the falling. That would be the second exercise. And the third exercise, which I told you was going to be a little bit of a combination of concentric, eccentric, and so on, we're going to do it with a stick that weighs a little bit or a broom handle. So we're going to take it now and we're going to do a pronation. We're going to bring the palm of the hand downward until it's parallel to the ground. And then we're going to come up and we're going to do a supination gesture. The other way around, we're going to bring the palm parallel to the direction to the ceiling. It is possible that on the way down, which is what you have to resist, you do it well. But then on the way up, it bothers you a little bit. Then you can help yourself with the other hand and do only the downhill phase. Exactly the same here. We're going to go up north and we're going to do 2 sets of 10 repetitions. But 1 repetition would be the whole cycle. 1 repetition is, I go down to here, I come up, down to here, and go up. That would be 1, and we're going to do 2 sets of 10. And we have a very important question now, which is, what can't we do with an epicondylitis? Well, it is important to acknowledge that epicondylitis is a form of tendonitis, just like any other. Henceforth, we must not disregard the pain and proceed with our regular daily activities, as doing so may exacerbate the condition, because that is going to make the injury more and more aggravated and more difficult to treat. So, we have to be a little bit picky about the pain, and we are going to try to avoid doing all the things that hurt. To effectively address the issue, it is crucial to first determine the specific gesture that led to the injury. Whether it was a sporting gesture or an everyday one, this identification is essential. But we have to have clear what is provoking it to us, to be able to avoid it, or in its case, to adapt it if we have to continue doing it. But the first thing is to know why we have injured ourselves. Secondly, this type of pain is very common in racket sports, both tennis and paddle. Then, it is going to be very important to evaluate the technique of the stroke. Many times, especially in the blow of the backhand, when we make the gesture, if we finish it with the wrist, the excessive stress on our tendon due to improper hitting technique can have detrimental effects that will make us more prone to this type of injury. And the second thing with the racket that we have to evaluate is the width of the grip. If we have a very wide grip, it's likely that our tendon is experiencing excessive stress which exceeds its capacity. Consequently, we must modify the grip width in order to alleviate the discomfort we feel. Second very common case, in the office with the mouse. When using the computer mouse at the office, it is important to hold the wrist in an elevated position to prevent strain. It's highly likely that our tendon is under a significant amount of tension. Hence, it is crucial to prioritize good ergonomics at work and make use of a well-padded cushion that provides adequate support. The hand to be in this position and never in this position, so that the tendon does not suffer. And second option, it would be advisable to buy a vertical mouse, an ergonomic mouse, that the position of the hand, instead of being this one, is this one. Then, here the tendon has much less stress. So much for our video with the 4 phases for epicondylitis, self-diagnosis, self-massage, exercises, and recommendations. Even so, we are going to leave you a few more videos about epicondylitis in case you want to complete the information. And if you like the video, we appreciate a like. We aim to address and resolve your doubts in every comment we receive. And if you subscribe and hit the little bell, you will be notified of all the videos that we are uploading. And as we always say, to healing and beyond. Goodbye.